Okay, so hello. It is my privilege to introduce and have a conversation today with two of my colleagues who are based in our Myanmar office. They are from ADRA Myanmar. I'm going to ask them to introduce themselves. And then we're going to talk a little bit today about how the ADRA Myanmar office is responding to the challenges of COVID-19 and how it impacts our project, a Case to Learn project, which we will talk and explain a little bit more about. But for now, let's start with our introductions. Perhaps, Claudio, can we start with yourself? Could you introduce yourself?
Yes, sure. Good morning, everyone. My name is Claudio Sandoval. I am the country director for ADRA Myanmar, starting since 2016. So it is my privilege to share some information with you today.
Fantastic. And John?
Thank you very much. Good morning, everyone. My name is Johnny Mbonderi. I am the programs director for ADRA Myanmar. This is actually my first year working with ADRA Myanmar. My pleasure.
Fantastic. So we have ADRA Myanmar's management team with us. So we're going to have a great discussion. So first of all, maybe can we just start off with maybe a bit of background and context around the situation of COVID-19 in Myanmar currently?
Sure. In Myanmar, the number of cases that are reported as of today by the Ministry of Health is 127 confirmed cases with 5 deaths. If we compare to other countries, we can say that the number is relatively low, but it has been increasing during the last days. Last week, at this time, we have 85 cases, and so the numbers are escalating despite the measures that the government has been putting in place. We can say that here in Yangon area, there are 7 townships that are in complete lockdown. So the city of Yangon is not in complete lockdown, just some areas specifically, but the government is also extending measures around the country. You will understand that as we have a big border with China, we have some kind of concerns as Myanmar population or whoever lives in Myanmar due to the proximity with China. Regardless to that, we can see that the numbers are, surprisingly low, but also population have some kind of concerns about this information. So everybody's taking the quarantine or whatever restrictions that government is putting in place very seriously, because we know the situation is sensitive. So yeah, government has shut down the international airport until 30th of April, for example, and also taking care of the borders, with Laos, with China for sure, also with Thailand. We have migrant workers coming, and government is also taking precautions on that. So whoever comes to the country, not anymore by air, but by land, also they should be tested and put in quarantine.
Sure, of course. No, thank you for that, for the context. And as you said, the close proximity, of course, puts Myanmar even more at risk because of the cross-border. So thank you for that context. Can you talk a little bit now more about the context of COVID-19 on our project? Maybe give a bit of an introduction to those that are watching who don't know much about our Case to Learn project that we are partnering together on.
Okay, thank you very much. Maybe just a little bit of background. As ADRA Myanmar, our country programming portfolio cuts across 4 thematic areas. This includes education, includes health and nutrition. It also includes agriculture and livelihoods, as well as emergency relief programming. And we are in partnership with ADRA UK to provide access to education to the conflict-affected population in some of the remote areas, where we have got one of our flagship programs funded by the European Union over the next 5 years. So basically, it aims to provide access to basic education, early childhood development, a little bit of TVET, vocational technical education, as well as non-formal education. So basically, this is part of the program which ADRA UK is supporting us. And also it feeds into our country program portfolio, which I have just highlighted earlier on. Further to that, maybe in response to what you have just said, say that the effects of the COVID-19 pandemic to our country programming. So yes, this is a new situation for most of us humanitarians as well as development workers. It somehow caught us unaware, and we have witnessed kind of a burden in terms of humanitarian needs, especially in some of the targeted communities who are already affected by the conflict. And with the inception of this COVID-19, we have seen more humanitarian needs being recorded across the country. We have also witnessed reports of disrupted livelihoods opportunities and livelihoods options within the communities. We have also witnessed some reports in terms of protection concerns, gender-based violence, and so forth. So these are new needs, humanitarian needs, being ushered into the context within the country. And definitely we have been struggling to cope up with the increase in humanitarian needs as well. Further to that, we have also faced the challenges which directly relates to the measures being introduced by the government and also by the other humanitarian actors in response to the safety requirements in response to this COVID-19. We have seen restrictions in movement. We have been maintaining social distancing. All this have affected our capacity and our ability to timely implement some of our planned activities. In response, we have also tried to postpone some of our activities, and we have also witnessed the effects being also experienced in terms of the health of our staff well-being, in terms of psychological capacity to cope up with the effects of this. We are also complying with the government directives to maintain the social distances, whereby we are also recommending our staff to stay indoors, to stay in-house in response of this. So all these measures are also coming up with the significant psychological challenges which our staff are somehow trying to cope up with. But basically, these are some of the significant impacts which we have recorded in the country in terms of our programming.
Sure. Thank you for that, John. So, you mentioned the issue of gender-based violence, which I think the statistics across the world are going up. The more that people are forced to stay home due to lockdown, there is an increase in gender-based violence, and we're having the same problem here in the UK. So I think that is a worldwide challenge that countries are facing. I just want to clarify one point with you. Because Case to Learn project predominantly works in schools, are the schools still open in Myanmar or in our target area, or are they currently closed?
Yes, currently the schools that we are targeting are currently closed. Apparently, Myanmar, the school calendar, the schools are currently closed based on the regular school calendar. Okay. We are expecting them to open sometime early June. this is where we are expecting the schools to open. But still, we are not yet sure in terms of the certainty of the schools being opened in light of this pandemic. So we are working closely with other partners. We are working closely with the Ministry of Education to assess the context to see if we can reopen, depending on how the situation will look like. But we are also working with relevant stakeholders to make sure that we have got a contingency plan that will make sure that our education programs keep on going. Vulnerable children have continued access to education in light of this. So some of the ideas which we are exploring is the need for us to provide online learning methodologies, online teacher training. Those are some of the things that we are brainstorming. So we are in the process of currently working on a comprehensive contingency plan just to ensure that our case to learn project will continue to provide education services to the targeted vulnerable communities.
Sure. So let's talk about, because I know I've been to Myanmar twice now, but for those that may not be familiar with the country, our target area is quite vast, right? So we have some, very, very rural areas, some areas that are very hard to access that you need almost 5 hours of transport to get there. So, it seems that, this pandemic has aligned with the school calendar of closures. So that has worked. So I'm guessing that we're going to utilize this few months that we have to see what strategies that we can put in place. But in terms of those that are, in those very rural locations, we talked about challenges of, concerns around gender-based violence. We're looking at, how we can continue to keep in contact or communication with our pupils. We're also talking about potential online engagement. I know we're still figuring this out, but do we have any plans for those that are, in the most remote areas to see that how we can engage and support them while still protecting our staff as well?
Yes, so we are in discussions with other education actors, with relevant stakeholders, and some of the ideas which we are brainstorming is also including the need for us to introduce small groups, which are considered to be less risk in terms of exposure to infection and spreading the virus. So we are looking of considering significant or small numbers in terms of the classes, in terms of education provision at community level. So yes, I would say at this stage it's still a little bit quite earlier for us to come up with a conclusive statement in terms of what we are envisioning as the way forward, but we are exploring every available alternative which we can engage in to ensure that we will keep on providing education services to the most vulnerable, which we are targeting.
Sure. And of course, with this project, we're quite fortunate that we are working with many local partners, at least 12 local partners who are based in the community. So that must also help strengthen our network. Because, if we as ADRA UK, ADRA Myanmar, of course, ADRA Germany is part of this partnership. If it was just us, we may struggle. But having those local networks and those local organizations also helps to ensure that we have more capacity and more hands to reach those at the community level as well, who are most remotely based.
For sure, definitely. We have got a network of 12 local partners who are strongly grounded into the community structures. So those are also the mechanisms that are in place, which we are trying to leverage on and capitalize to ensure that the education services continue to flourish as during this period of time. Yeah, for sure, definitely.
Sure. So let's talk a little bit. So we've talked about the mitigation strategies at the project level, which of course are still evolving, and probably in the next month we'll be able to have a more a bit more certainty about how we can address it. There's so many factors with the government plans, with not knowing how long the lockdown is going to be going on for. But in terms of ADRA, ADRA Myanmar, you know, what strategies are you putting in place? I can see that you're all working from home. This is not your typical office environment, so I know that's one strategy, but maybe you can talk a little bit more about what else you are doing to protect also your HQ staff in Yangon.
Yes, regarding to that, as you rightly mentioned it, we are in the working from home modality. We started almost 3 to 4 weeks ago when the situation started to rise here in Yangon. Mm-hmm. And we adopted that modality first by implementing our country crisis management team. So we started to have daily discussions with our committee members of the CMC and to analyze the situation. And so one of the first measures that we took and we agreed upon was to make everything possible in order to adopt that modality. So before we adopted the modality, we analyzed the situation. We worked with each team, finance team, program team, and admin team in order to make this, to make the proper arrangement. So when we adopted the modality, we had the business continuity plan already in place. So what we are doing is just a response to a very well-organized actions that we had from the beginning. So we have this modality running until the 30th of April, and we will reanalyze the situation in due time, and also considering what the government saying in terms of restrictions and provision of measures. So, for example, government has just reopened some government offices and also have re-established the Yangon bus system. Although we are still encouraging our staff not to use the bus service, but when they need to come to do some kind of physical work at the office, they will be using a taxi, and there is a system called Grab that you can also track the users, so you can use that system, so you will be safer than using the normal public transport system. And also at the office, we have the provision for hand sanitizers and other measures that we are taking in place. And each person who physically comes to the office has to register also. So if we have any employee that presents symptoms, we can also track the other people there have interacted with during a period of time, so we can also monitor and check on that regard. Those are some of the measures, and we are having now 3 times a week the meetings through Skype. So we are always updating our staff about the measures that we are taking, the recommendations, and also we are discussing how our teams are doing, if they are having some challenges in the performance of their activities, what is needed, what can be changed. So we are closely monitoring, so we are trying to ensure that the activities that we are performing are still doable and meaningful. So as John rightly put it, you know, for example, for Case to Learn, we are always trying to analyze and prioritize those activities that are doable in this context, and to stop the ones that may represent more risk or definitely cannot be conducted due to also government restrictions. So we are closely monitoring the situation to be in compliance with what government has established, but also what ADRA Myanmar has established for our own safety and security. Because at the end of the day, it is not government who is the responsible for our staff safety and security, but it is ourselves.
Yeah, absolutely. And I should also just add that the ADRA Myanmar team also shared a specific risk matrix for COVID-19, which was very, very thorough. And so all of the things that you are sharing is of no surprise to me that, you know, you have all these systems already in place because you are a very well capacitated office. And of course, as well, the country that is, you know, we consider to be in a protracted crisis on a regular day anyway, is obviously prepared, much better prepared than maybe other countries to handle such a crisis like this. Anything else that you'd like to tell our viewers about COVID-19 in Myanmar? Any final thoughts before we wrap up today?
From my side, maybe Milimo is what ADRA Myanmar is trying to do with our different donors as office in terms of our staff safety and security and also job security. Some of the concerns from our staff is, you know, if this go longer, perhaps some donors will have concerns on, you know, time allocation for project activities, though we are not able to conduct some of the activities. So we need to also reaffirm and reassure our staff that we are doing our best to engage the donors in our discussions so they understand. And for sure, this is a globally, you know, a known situation, but you have followed the news, you know, in some countries where enterprises, you know, companies have been dismissing furloughed employees. So we don't want to come to this situation. And one of the messages that we are sharing with our donors is that the you know, the more we keep our staff during this situation, the quicker we will catch up when the situation comes more or less to a normal. Because if we lose staff now due to lack of activities or not recognizing the cost for, you know, keeping staff, we may lose well-trained employees that will be very difficult to rehire later on. So the catch-up of the activities will be slower. So by maintaining, by being patient, also as donors, we can guarantee as ADRA Myanmar that our activities will come to normal quicker than having to rehire staff and having to reconform our team in order to continue to perform our activities later on.
Sure. And of course, you know, what our biggest desire and hope, and we're seeing it in some of our countries or some of our projects, is that the donors will actually allow us to specifically respond to the challenges and the issues of COVID-19 and the impact of it. So some donors are actually starting to release additional funds so staff can continue to work and operate, but knowing that some of the project activities might need to pause to allow and accommodate for us to deal with this crisis. So that we're hoping that, you know, this could also be something that we will soon come to Myanmar, and donors will also allow that flexibility with this particular project as well. John, any final thoughts?
Yes, for sure. As I have highlighted earlier on, said that we are witnessing a significant increase in humanitarian needs. So we are now working in terms of positioning ourselves as a humanitarian organization also to remain at the forefront, saving lives, supporting the most vulnerable. And we have already started realigning some of our existing budgets to respond to the effects to the humanitarian needs induced by this pandemic. So it's something that we are working on as well. We are also in the process of engaging our traditional donors for extra resources, as we have rightly mentioned. Something that is also in the process just to upscale our current response activities as well. So yes, as ADRA Myanmar, we want to assure our beneficiaries that we are there for them. We are always at the forefront, providing the required services, and to ensure that everyone has got yes, is protected in terms of having the required life, having the required services and so forth.
Fantastic. Thank you both. Thank you so much for your time. Thank you for sharing. I'm pretty sure that our viewers would have found this discussion very interesting, very engaging. We've, a very clear understanding now of, the challenges that you're facing in Myanmar and how you're trying to respond to them. There is so much uncertainty around this crisis, and we're hoping that together through our partnership that we can continue to find solutions, that we can continue to support our beneficiaries and also our staff, ensuring that both groups remain safe. Thank you so much.
Thank you. Thank you for the opportunity to share.